This lecture introduces the concept of brittle drainage angles. A brittle drainage angle is one that has reduced functional reserve and is therefore, as a consequence, prone to instability with unpredictable, intermittent, high intraocular pressure spikes. Situations which may cause decompensation of angle function include any sudden stress on the angle. For example, during intraocular surgery, phaco-cataract surgery, or microinvasive glaucoma surgery involving the angle, where there may be bleeding. Laser procedures, such as YAG laser posterior capsulotomy and YAG laser peripheral iridotomy. The use of topical or systemic steroids, or episodes of intraocular inflammation. If one knows how to detect brittle drainage angles, one can predict eyes and patients that are going to respond potentially adversely to these situations. I think of brittle drainage angles in the following classification. I start off by thinking of the various forms of anterior segment dysgenesis. Examples may include primary congenital glaucoma, Axenfeld-Rieger's syndrome, aniridia, Sturge-Weber syndrome. And the key is that these brittle angles are prone to unpredictable intraocular pressure spikes. For example, if we look at the natural history of Axenfeld-Rieger's syndrome, patients can go through periods of intraocular pressure instability, often as a relatively young child between the ages of 5 and 7, once again in their early 20s, and once again in their middle age. One of the classic examples of brittle drainage angles are patients with juvenile open angle glaucoma. These patients very classically develop very rapid elevations of intraocular pressure into the 40 to 50 millimeter mercury range, which can lead to progressive and sudden severe damage.